Thank you for the opportunity to speak with you today. Founded in 2008, Acción Técnica Social, ATS, is a Colombian organization that works with institutions and people who use drugs in the improvement, design, and implementation of policies regarding psychoactive legal and illegal substances. Focusing primarily on risk reduction and harm mitigation, we execute programs using peer education with non-problematic or recreational users in nightlife and leisure spaces, with people who consume alcohol in higher risk settings, and through comprehensive programs for people who inject drugs. In the last year, we have had direct contact with 51,000 people and over 440,000 people indirectly, allowing us to build a comprehensive database and generate evidence regarding policies that work. From Latin America, a dialogue has sprung up around reducing not only the harms of drug use, but also the harms of current policies. We are breaking new ground regarding how to reduce the harms of these policies to protect our communities, respect human rights, and foment development. Innovative new programs are being implemented, and evidence is being generated that shows positive impacts on current consumption behavior, particularly related to so-called new psychoactive substances. Based on international and national evidence, we recognize that the majority of people who use illegal drugs do so without developing any problematic use. Échele cabeza cuando se dé en la cabeza, or use your head before it goes to your head, is a project specifically focused on nightclubs, music festivals, and raves to provide information and substance analysis services. This allows the organization to have a clear picture of the ever-evolving illegal drug market, while providing timely health alerts for people who are considering using drugs. This service is underscored by accessible informational campaigns that have quickly become collector's items within specific populations. Higher levels of information and education are reaching those who need it most, via trusted channels of communication. Since 2012, Échele Cabeza has analyzed more than 2,000 samples and witnessed a 25% reduction in the adulteration of ecstasy and MDMA pills. 88% of users who utilized the service decided not to consume the substance if they received a negative result. ATS has emitted 17 health alerts to bring attention to the adulteration of cocaine, fake LSD, and 2CB. These alerts were shared more than 45,000 times on social media and taken up by both print and TV media. With these health alerts, ATS has saved lives. According to the Colombian Ministry of Health, emergency room intakes because of intoxication has significantly dropped in the last 4 years in Bogotá. After a campaign by ATS related to healthier consumption of alcohol, emergency room visits related to alcohol decreased from 738 in 2011 to 331 in 2015. Emergency room visits for stimulants such as amphetamines and ecstasy dropped from 82 in 2012 to 37 in 2015. These changes in perceptions, understanding, and safer drug use have led to approximately 500 people not having to enter an emergency room setting, resulting in a cost savings of at least $260,000 for the city of Bogotá. Focusing on pragmatic and evidence-based programs, ATS seeks to improve the choices made by people who use drugs, recognizing that there are risks and benefits to any behavior. The illegal drug market moves quickly, and Acción Técnica Social is nimbly able to track the market and provide information not only to people who use drugs, but also to city and national authorities within a human rights and harm reduction perspective. The above services are directly impacting the capacity of Colombia to implement the UNGAS document. Not only are new substances entering the market, there is also a new generation of responsible users that is forming into a global network, and that are quickly opening cultural and political spaces and generating evidence based in harm reduction. We hope that these examples can help other countries change lives, save lives, and understand how to promote more responsible consumption.